So I'm Paisley Williams. I'm the prevention manager at Casey Care. And so a little bit about my profession. So I have a master's in public health, and I've been doing prevention work since 2014 after I graduated. Yes, I understand why some people might be hesitant to get the COVID vaccine. This is a new invention, a new vaccine that most of us have never experienced. I think the last one was like the Spanish flu. And so, with this being a pandemic that we've learned when we grew up in schools, and the difference between pandemic and epidemic, um, this is the first time of us living it. So most of us are a little leery because it's not like the flu shot or any other vaccine that we got, or any other immunizations that we got in growing up. And you know, also validating people's feelings and concerns. It's like the fear of the unknown, because we don't know how most people would react, what symptoms they may have, and again, kind of comparing it to the flu vaccine that we get yearly. You know what to expect because you get that yearly. You know what to expect when you get your TB test, and um, if you become reactive to TB, you know what to expect. But with this vaccine, we draw our attention to the media because that's how we're getting our information, our data, either through reading or through the media. Like most of our doctors don't know neither. So the fear of the unknown, the fear of the trust, that we don't know to have. I can definitely understand why people are concerned and have the feelings that they do. My experience with vaccines, is really just the flu shot. I don't really recall the ones in my younger years. I kind of go off of what, my husband had told me about. It's like that new PS5 that came out, or any new electronic. I don't know if you remember the Samsung Razor phone, but they start making these things, and it's like, hey, let everybody go out and buy it. And I'm not going to get it because I want all the technology kinks to be ironed out by the time I get it next year. I can see, and I took on that same analogy because it is new. It is something that I've never had before. And I did hesitate. I hesitated for a long time, but due to Casey Care having such a great communication network amongst the employees, I started to get a little bit more comfortable. Kind of decided like, hey, my hesitation level kind of went down a whole lot because of the work that Casey Care is doing. The reason why I actually got it was my in-laws and my parents actually started to get it first before me and my husband. And they are in the baby boomer age group, and they saw it as an importance because they wanted to see their grandchild and wanted to travel. And that was more so the decision factor, because I started to have communications in my own family circles about it. And especially with my mom stressing, the fact that, I want to be here on earth as long as I can. I want to see my grandchild. Realizing that they were okay with their first dose, me and my husband was like, okay, then let's go ahead and get it, because we weren't going to get it. I mean, to be honest, probably later this year or next year. um that was the long-term goal, but we was like, we kind of want to travel too, so maybe this summer. But it was going to be, if it wasn't for them, it was going to be like later this year.